Department of Family and Community Medicine. This is a case presentation.
Nawala po ba, Dok?
On a diabetes mellitus patient.
Meron, Doc.
For the general objectives, to present a family case presentation on diabetes mellitus, to utilize different family assessment tools in the care of my family, and to present a wellness plan for my identified family.
This is a case of MQ, a 52-year-old female separated from Paso Nangka, Zamboanga City, who called in our teleconsultation because of chest pain for 3 days. During the consultation, I found out that the patient is also suffering from diabetes mellitus type 2. She was on metformin once a day for 9 years with no follow-ups. And now, with the help of her symptoms and lab exam, we diagnosed her with stable angina, probably secondary to chronic arterial disease, also with chronic kidney disease stage 3A, probably secondary to DM nephropathy with hyponatremia, and diabetes mellitus type 2 uncontrolled.
I noticed from the patient's lifeline that it took her 10 years until her next consult. Also look into the recommended monitoring for DM type 2. Ideally, HbA1c is done every 3 to 6 months, 2 times a year if controlled on stable therapy, while FBS postprandial sugar is usually 2 to 4 weeks. Capillary blood glucose is 2 times a week to estimate the trends. Glycemic target should be achieved within 6 months of diagnosis or first prescription. This led me to think that the patient had poor seeking behavior. Despite having seizures at home and chest pain, it took her 3 days before she had any consult. Healthcare seeking behavior is any action or inaction undertaken by individuals who perceive themselves to have a health problem or to be ill for the purpose of finding an appropriate remedy.
Because of my curiosity regarding health-seeking behavior, I looked into how to assess the patient's health-seeking behavior, and I found out a tool using health-seeking behavior on diabetic patients in Iloilo City. I tried to use this tool in my patient's health-seeking behavior. This was the result of the health-seeking behavior tool that I used for my patient. The patient had a mean score of 1.7. As you can see in the interpretation, that 1.7 may mean that the patient may be having a poor health-seeking behavior. Thus, the patient has a poor health-seeking behavior for diabetes mellitus. With this, I began to ponder, is this only happening to our patient?
I then explored the family lifeline of the family. It also showed how MQ responded to the situations in her life, such as frequent headaches during the time that she had marital problem, as well as the time she had back pain during a problem with her child, and also the time that she was diagnosed with diabetes, what were her symptoms, and anxiety during the pandemic.
What leads to diabetes? Type 1 and type 2 diabetes have different causes, but there are two factors that are important in both. One inherits a predisposition to the disease, then something in one's environment initiates it. Type 2 diabetes has a strong link to family history and linkage than type 1. Yet, it also depends on the environmental factors. Lifestyle also influences the development of type 2 diabetes. Obesity tends to run in the family, and families often have similar eating and exercise habits. If you have a family history of diabetes, it may be difficult to figure out whether your diabetes is due to lifestyle factors or genetic. Most likely, it is due to both.
me to look into their family history through the aid of the genogram. For what is a genogram? It is a pictorial display of a family's family relationship and medical history. It goes beyond the family tree by allowing the user to visualize hereditary patterns and psychological factors that punctuate the relationship. As what I've mentioned earlier, DM has a strong familial predisposition. The chances of having diabetes mellitus in the family is high. And this is a complete genogram wherein it consists of three or more generations identified by the Roman numerals as you can see in the left side. And the firstborn of each generation is farthest to the left with the following siblings going to the right in order of birth. The family name is placed above the major family unit and names and age written below by the symbol. The index patient is also identified with an arrow. Date is also indicated when it was made and adjusted as ages over time. As you can see in the genogram of Libradilia Quijano family, the family members have diabetes mellitus and suffering from different complications of disease such as stroke, DM foot, DM retinopathy, and CKD. The patient is also diagnosed with CKD at the time of consult. So, the Librano-Quijano family, the family dynamics of this family, may contribute to their health-seeking behavior. They are an extended family and a launching family.
So as a review, the criteria for diagnosing diabetes: fasting plasma glucose should be greater than 126 milligrams per deciliter, and random plasma glucose should be greater than 200 milligrams per deciliter in a patient with classic symptoms of hyperglycemia, such as weight loss, polyuria, polyphagia, polydipsia, or with signs and symptoms of hyperglycemic crisis. 2-hour plasma glucose in 75 grams OGTT of greater than 200 milligrams per deciliter is also a criteria for diagnosing diabetes. Local studies have also shown that newly diagnosed diabetes in Manila City, wherein 20% has peripheral neuropathy, 42% has proteinuria, and 2% has diabetic retinopathy during the time of diagnosis. With the different factors in mind, I diagnosed the patient as having poor health-seeking behavior.
This is something new for me, and so I asked the view from a friend of mine who is a psych resident doctor on how to deal with this situation. And we agreed as to look into the root cause of this, and this will guide us in the process of addressing this poor health-seeking behavior. Psychological education can be used in this situation after identifying the cause. This is a problem tree of poor health-seeking behavior. Possible causes that were identified for our patient includes the cultural aspects of health, economic reasons, and maternal nature of the patient. Since mothers tend to delay having themselves checked compared with other members of the family, effects include late diagnosis. It also may include poor compliance and poor lifestyle, complications of disease, and may impact permanent disability and burden on finances.
Plan to present the family tree during the family meeting with the family. We should not only address the patient's problem, but as well as address it with other members of the family.
On doing the family APGAR, the family scored 8 to 10, which is highly functional. This is a great chance in improving a bad behavior.
Family APGAR is needed when the family will be directly involved in the care of our patient. Especially in our case, there is a need for compliance to medication and lifestyle modification. In a brighter side, this family will have a good start in improving their health-seeking behavior since their level of satisfaction in regards to their family relationship is high. This is a family circle. As you can see, the families draw their circle. DM has microvascular complication. I explored the relationship to the family mapping. I have identified that Bonnie is the breadwinner of the family and Anthony is identified as a therapeutic ally of the patient. This led me as their family physician to enroll them as a family and help them improving their health-seeking behavior. Changing a behavior is a process.
Going back to our patient, what can we do for our patient and her family?
And then I thought, hmm, first wealth is health, and that is through wellness. This led me to devise a family wellness plan for MQ, a 52-year-old female with diabetes mellitus, stable angina, and CKD. So she needs to change her diet and also physical inactivity with moderate to intensity exercise, screening as well, breast self-exam, mammography, pap smear if they can, and fecal occult blood. Vaccinations include flu vaccine, pneumococcal vaccine, and COVID-19 vaccine. Also for chemo prevention, which she already has, metformin, linagliptin, ISMD, ismNIMIN, and rosuvastatin. Neymar, her eldest son, he also has DM type 2. We also need to modify his diet and also physical activity exercise and also screening for eye, heart, kidney or nervous system, any complications, BP monitoring, lipid profile, HbA1c as well, and also advise them to have COVID vaccine and flu vaccine. His chemo prevention includes metformin 500 milligrams, 1 tab, 2 times a day. And for Yvonne, who is pregnant, we advise her to have active daily task exercise such as sweeping or perhaps washing the plates. Then also for birth plan and her birth spacing, and also prenatal visits, which she achieved 2 out of 4. 4 is the recommended uh, prenatal minimum health visits for pregnant women. Gestational diabetes as well will be screened, bacteriuria and STI, and breastfeeding counseling. For her tetanus toxoid dose, she has a complete 5 doses. And for COVID vaccine, all vaccination, she will be advised for this as well. For chemo prevention, we also advise her to continuously take her prenatal vitamins such as the ferrous sulfate. For the kids Arno and Amery, we need to also assess their height and weight, language, and play. So language intervention is target and intervention cannot be overestimated because of its central role as indicators of cognitive and emotional development and a key factor in behavioral regulation and later school success. We also look into their diet, television, and similar media limited to 2 hours per day of quality programming, and parents should be watching the programs with their children and debriefing their young child afterwards. We also have to screen for visual, dental, and nutritional health. For vaccination, the expanded program for immunization that is given in health center is given to both of them, while they do still need varicella, hepa A, and flu vaccine. For chemo prevention, we can give them annual deworming for parasitism. For Anthony, we also need to look into the risk for diabetes. Also, his diet, physical inactivity, and for smoking cessation since Anthony is smoking 5 sticks a day. Also need to screen early for DM hypertension. And for vaccinations, COVID-19 vaccinations, for chemo prevention, still, he didn't need any for now.
In order to make a wellness plan, we need to put into consideration the patient's financial aspect. This is by the aid of the SCREAM method.
Also consider the hindrances of the family that might encounter in the wellness. So for the screen, as you can see, the resources and their pathology. And for the cultural pathology, wherein they self-medicate regardless of their medical background. And then also for the most important is their economic burden, wherein they have enough money to provide for their daily needs, but in times of crisis and illness, the family needs extra money.
Through the SCREAM method, I was able to classify this family as a low-income class. This will affect and add burden to the family. And as their family physician, I explored their family echo map for resources. Together, we identified the resources of the family. We have the barangay hall for the barangay certificates, barangay health centers for medications as well as for monitoring, neighbors for support and probable vegetables to share, programs of the public servants possible for monetary and medication support, and tapping the DSW for other support as well. As a summary, I saw that they have a poor health seeking behavior. It may be contributed by her living in an extended family, a lounging family wherein her children are staying with her, a family of low income class, and major therapeutic measures wherein they still need to control her sugar and maintain it in a stable condition. But we can commend the family's highly functionality and hopefully it can be maintained. As I manage this family, I realize that each family is unique. Health seeking behavior is multifactorial and varies depending on age group and status. As a family physician, we have to observe and weave together what we have learned from this family. We should not only look at the problem and weakness of the family, but also highlight their strengths. This will then help us make management more specific and appropriate.
Thank you very much and God bless.
Thank you, Doc A. That was indeed a thorough family case presentation. So you reviewed to us the different concepts of diabetes. You explored the resources of the family. You identified innate characteristics of the family that can help them go through the healing process of their sick member, as a family. So congratulations. So at this point, the floor is now open for comments, questions, or clarifications from the group. You can unmute your mic to speak or type in our chat box. So let me start na lang, Doc A. A question from Dr. Espares. At what age of gestation you can recommend OGTT? And after delivery, what will be the next test that you can check and when?
As I could recall, Doc, yung at the time of the age of gestation, usually we screen in the second trimester of pregnancy, usually around 25th month to 26th month during age of gestation. So OGTT is done. And then for after delivery, what we need to check is also we have to still monitor the patient kasi sometimes some patients who have gestational diabetes can what they call this, parang maano yung ma-adapt nila yung, yes doc, 24 to 28 weeks, and then after that for some time yung diabetes nila doc can be ang tawag nito, maano siya, yung madala niya in a sense na the patient can be diagnosed as diabetes as well. I'm sorry, Doc, medyo mahina yung recording. Hindi ko alam bakit mahina siya.
We can call it ba overt diabetes na, di ba? If ever.
After
Diba,
pregnancy po, Doc.
like gestational. Yes, opo. And then after that, you have to wait after what weeks? So for the benefit, no, it's 6 weeks that you have to check the HbA1c. So in your slides na lang, Kay, kasi it's important also, like you have to you have to educate that OGTT should be done at this week kasi baka ma-late na rin, no, yung ano, although she's on 24 weeks. And then after that, if ever you would know that this would be the patient have gestational diabetes, you can refer it to endo because of the yung ano, what will be the result ba of the if ever the mother have gestational diabetes.
So usually, Doc, for mothers with gestational diabetes, they can have macrosomia. Ibig sabihin, pwede yung malaki yung baby nila, na
Yes.
mahirapan silang manganak. And then, as well as yung bata magkakaroon ng hypoglycemia. So, kahit
Yes.
malaki yung bata, may possibility na hypoglycemic pa rin yung baby that we should watch out pa rin po, Doc.
So it is how it is important na sa family pa rin yung we would know. It's very good also you have also explained, no, at the same time, although this is a family case, no, but then some background also of the medical, kasi we could although there is a family, sometimes after is a family dynamics that we should learn, but also good thing that you also have included the about the medical background. And then yes, no, that is true, no, yun yung importance, kasi we do not want, that's why we have wellness among family, because we do not want that they will have another crisis, no, they will have another crisis in their family, knowing that they already have this diabetes. So as we all know, pwede siya talaga familial talaga. And then, yun, the result of this also, we are correct, no, Kay, na, and also, if ever hindi the sugar or no is not controlled, no, to the if the sugar is not controlled to the pregnant woman, so the tendency, the child also parang mag-compensate siya, and then that will lead also to the child having a diabetes, no, kasi or worse yung pancreas niya it will be affected. So that is why accordingly daw, that is how important, no, to identify patient with GDM, and then kung if ever after 6 weeks if naging yun din yung magiging natin sa family. So how it will also help to the family. So thank you, Kay. Congrats.
Thank you, Doc. Sorry, Doc, sa audio.
Thank you, Doc Jam.
Dr. Kay, Dr. Joe.
Hi, Doc Joe. Good
Yeah,
afternoon.
first question lang, this was a pre-recorded presentation, no?
Yes po, Doc.
Technically, oo, medyo nawawala, pero I was trying to follow your thoughts and it's very nice. Kaya lang nawawala in between. Hopefully it can be recorded again for filing, no?
Yes po, Doc. I-try ko
Yes.
i-record po again, Doc.
Yeah. Anyway, follow up with with the good question of Dr. Jamsin. When do you say that it is? Dr. Jam said 6 weeks, no, ang cut off the GDM. So after that, it becomes frank DM already,
Yes po, Doc.
T2DM. Okay. Sorry, no, I was in between. Ano ba yung danger na, I go back to biologic part, danger of having GDM, and especially or signs, even if you have within normal blood sugar, but there are some signs already, especially during the first or second pregnancy, that you might be dealing with this in another pregnancy. You get my question? Ano mga signs ng, especially during the gestational part of her pregnancy, that might you might put the question whether she's having GDM, no, gestational DM.
What do you mean, Doc? Bale, ano yung probable na symptoms ng patient ba yung
Yeah,
hinihingi
mga
niyo po,
other signs and symptoms that the patient is undergoing gestational diabetes. One is excessive birth weight, correct?
Yes po, Doc. Usually, ang iba din, Doc, they say na yung kapag female daw yung, pero incidence lang to, Doc, more commonly kapag babae yung anak, high risk daw din na nagkakaroon ng
parang GDM yung mother accordingly.
Okay.
No?
Did you see in your readings the increased incidence of preterm birth?
Yes, Doc. Since
Oh,
the baby is big, so there's a possibility also na it will have early or premature contractions po, Doc, for the patient.
okay.
Pwede rin
Now,
din
yes,
predisposition din such as yung history sa family of diabetes,
yes,
high
very
likely
important,
din po,
no?
Doc.
Now, when you're having GDM, yung gaya ng sinabi ni Dr. Jans kanina, because I had several cases like this, and if you are not aware, some of the complications, and especially for the newborn, what do you usually see, or what do you need to have the pediatrician be aware of if you're taking care of a patient with another physician?
With the
Ano ang mga tawag dito complications for the child or neonate?
Usually, Doc, for neonates, they exhibit hypoglycemia. So you have to really
Very
monitor
good.
yung
So,
glucose
ang danger
level.
dyan, nakakita na kasi ako nag-seizure na baby. We didn't know until somebody, especially if it's your first case and post-normal delivery, although you're a big child, uh, almost 12 hours after delivery, nagsi-seizure ng baby. So, imagine that. And then we had to, only to find out na severe hypoglycemia, no? So, yun lang. Thank you, Kay. That's very good.
Thank you, too.
Hello, Kay.
Okay.
Yes, Doc.
Ay, si Doc na lang. Si Doc Ponde.
Hello po, Doc Weng.
Okay. Were you able to prove us to the context of her symptoms? Like, what is or are her thoughts about her disease? Kailan ba siya na-diagnose? Alam naman niya no, na diabetic siya?
Yes po, Doc. For this patient, Doc, she was diagnosed 9 years ago, Doc, through parang a random blood testing po, Doc, in their area. And then, nag-take lang siya, Doc, ng metformin once a day by yung physician na during that time na nakadiagnose din sa kanya. And then, after which, Doc, wala na pong follow-up for the patient. So, yung patient po, Doc, lost to follow-up until recently, na nag-consult po talaga siya, Doc, is yung nag-seizure siya for 4 days and then yung 3 days may chest pain siya. So, it was there that I was able to ask the patient yung duration, no, yung tagal, ano po yung nangyari sa time na from the last consult until now. Parang, at saka, Doc, na medyo na, it got me thinking na bakit hindi siya, nung nag-seizure siya, hindi sila nagpa-consult agad. Parang
Ano
medyo
yung
naka-align po
context?
ako.
Anong nakuha mong context niya sa kanyang symptoms? Kasi like, di ba, yung difference natin sa yung routine na SOAP is scope. Meron tayong C,
Yes
yung
po, Doc.
context. So, ano yung
Context.
thoughts niya about her disease? Nadig ba yun? Sometimes kailangan malaman natin yun for us to really know where the patient is coming. Kasi 9 years na. And then, so ano yung thought niya? Ano ang C dito? Ano ang
Yung context niya lang, Doc, about diabetes, ang alam niya is mataas lang ang sugar. Pero I asked her regarding, alam niya ba kung saan niya nakuha, ano yung possible na bakit mataas yung sugar niya. Sabi niya, siguro sa family na rin nila kasi may diabetes na yung mga kapatid niya. Ganun lang, Doc. Pero more of sa lifestyle, natanong ko siya, alam niyo, paano po yung kinakain niyo? Alam niyo po ba yung soft drinks na, kasi, Doc, yung soft drinks nila, sa morning pa lang, soft drinks na daw po sila, parang water siya. And so I tried to explore na if alam nila na yung soft drinks, do they know na mataas po yung sugar? Parang aware sila, pero parang hindi nila masyado na connect na there is a possibility of yung soft drinks na everyday nila iniinom can actually cause ng ng kanyang diabetes po, Doc. and yung
At what
ano.
stage of illness trajectory mo ba siya na ano? Like, anong stage of illness trajectory?
Nag-ano na, more of doc sa ano na kami ngayon, major therapeutic measures kasi diagnosed naman siya of disease. Pero during that time na ano kami doc, yung sa may tawag na to, yung sa if you consider doc yung sa consult pa lang nung patient, nasa second stage pa lang po siya ng disease. So parang kala niya kasi doc parang sa metformin niya enough na yun yung tawag nito mawala yung diabetes doc.
So, no formal, consultation with a physician, no?
Yes po doc for this
The time na
patient.
nagpa-consult siya sa'yo, it's actually what stage? Like,
Yung sa
this is where we usually catch our patient. Like,
ano doc yung impact phase yung reaction to the
and with that, ano siguro yung ano mo, yung role mo as family physician?
with that doc usually we establish yung diagnosis natin, and if yung disease ba niya is we have to consider if kasi since diabetes can be yung kana chronic non-debilitating disease siya, so might likely we have to parang help the patient accept and parang help them in their treatment so that we can move yung sa major therapeutic efforts din po doc. So we have to also look into the reaction of the patient, if they parang alam ba nila doc, they accept or they know. It's also important to know as their family members kung ano yung alam ba din ng ibang kasama niya yung sakit nila doc, and who can be their parang ally in the disease, parang taking especially mga compliance to medication, which is very important in these kinds of diseases doc, na medyo matagal po siya doc, may maintenance po kasi doc.
Yung point ko of asking those two questions, no, para ma-emphasize lang sa atin that sa family physician, we need to look into the context and also to identify, isa yun, no? And also to identify at what stage na yung interaction natin with our patient, no? Like, in this case, we need to explore first what the patient and the family know about the disease and anong gusto nilang malaman. Kasi nga, true enough, if alam naman natin, no, that if we will just bombard them with medical, yung mga, baka hindi sila familiar. Sometimes, instead of enlightening our patient, we confuse them after our consultation. No? So, yun lang yung ano ko. And, ano yung reason for enrolling this as your...
Na-bother po kasi ako doc, kasi since yung consult niya matagal, at the same time, na-explore ko yung anak niya may diabetes na rin. So parang parang gusto ko sana doc, kasi yung parang naano ko is parang yung behavior nila, yung health-seeking behavior nila, parang for me, ano siya, yung nakita ko parang may kulang dun po doc. So I believe na yung mga anak, yung future ng family din nila, na gusto ko rin doc ma-prevent yung complications of the disease, as well as to help them lessen yung financial burden. Kasi especially if example may complications na talaga, may yung mga anak din niya, may family na din, so parang nagiging mahirap kasi doc, may burden na rin sa family, mag-add on pa to another burden if halos lahat sila ganun yung disease.
So, given your interaction with the patient, no, ilang beses mo na ba siya na-follow up?
Ano po, Doc? Mga 5 na po ata, Doc.
Right? So, probably at what level of involvement na siguro meron ka with your patient?
Siguro, Doc, masasabi ko siguro first, Doc, yung nasa second part ako, kasi yung na-CA ko po sila, Doc, more of sa tawag nito, yung CA sila, Doc, na usually. Pero ngayon, Doc, since may mga interventions naman din ako, more of level 3 na po siya, Doc.
My point of asking that is also for the resident to to and at ano yung expected level of involvement from you as resident, no? And probably at the stage of like year level mo, like probably for you as first year, expected at probably like third level of involvement, gano'n, no? And syempre kailangan alam natin anong level of involvement. Yung isa naman kanina, I'm just driving us to the yung mga stages of the impact of illness and ano yung corresponding responsibility or roles of family physician in each level. And you made mention about the extended family, no? Ano?
Yes po.
Oo, minsan kasi meron tayong different categories of extended family. Like in your case,
Doc, parang unilateral extended family siya.
yes, like probably between lineal or joint family structure, ano ito siya?
Lineal or joint structure, Doc.
Pwede kang magpa-SOS sa mentor mo or sa resident, sa senior resident. Linear, Jo? Linear, Jo?
Linear.
Bakit siya linear, Jo?
Linear.
Yes.
Generation. Two generations. Punto sila na unpasa. While in linear, for example, mother and then anak both has family. So if we can if we can compare it, si para lineal is lengthwise, crosswise in generation joint. Lineal, 2 generations at least.
Sige. So category. Dito sa kanya makita natin it's actually ano, Jo? Lineal, no? 3 generation, 1 generation yung patient, tapos lineal, no? Consisting of 2 or more generation. Qualify naman siya sa lineal, no? 2 or more generation with each generation having either may mga family. Second generation is yung ano niya, yung anak niya na married. So it's actually
And then,
sige, thank you. Okay.
Thank you din po, Doc, for your inputs, Doc.
Thank you, Doc Weng. Are there any more comments po from the group? Suggestions or questions po from our consultants and co-residents?
yan, yung, hello, yung suggestions, ialagay na lang yung sa wellness, yung para for the education, yung 24 to 88 weeks, tapos, at what, and then also sa patient, did you mention about mga diary o parang dapat kainin?
Hindi ko po, Doc, na-mention, Doc.
Will be your schedule for next okay?
Follow up po, Doc?
Follow up sa kanya so that we can at least, kasi diba, na talaga yung
Ano po,
so
Doc?
month. Oh, okay. And then para you mentioned also yung what type of counseling, no? Na-mention mo ba yun dito sa ito, already started na no, yung psychoeducation?
Yes po, Doc.
Meron na bang at least na, kasi pwede natin yun i-check, right? Yung if ever, kung about, kasi at this point, you also, so you already have done the psychoeducation in
Nag-start
which
po ako, Doc.
it is composed of and mga complications. Ganun ba yung psychoeducation case?
Symptoms.
But then
Actually,
you
Doc,
have also gotten first the CEA. You have gotten first the yung catharsis niya.
yes po, Doc. Very important po, Doc, in starting
Oo.
kasi para alam mo kung ano yung i-target din po, Doc.
Yes, oo. Although no, it is somewhat like psychoeducation. It is somewhat like the CEA also, no. Usually diabetes in which it is uncontrolled. So I've been to a lot of doctors, and then but then no, I'm with a good compliance in drinking the medicine, but why is it that it is not controlled? So yun nga na napansin doon, it's because of the life nila yung ECM, and then they have the education and the action. So the CEA, and then after the CEA, kung sa follow-up, if they still have the same insight after nang-educate mo, kasi it's always parang, even though you have done the CEA, ganun, sometimes wala pa ding insight, no? Kaya din importance yung importance din yung pagkakaroon ng pag-check sa kanila ng insight or the follow-up. 'Di ba usually nagpe-periodic health exam, kasi ito meron na rin 'tong also observe, no, yung mo biomedical, you also have put na yung mga nutritional, no,
Yes
and
po,
also
Doc.
the exercise. Oo. So for the benefit din sa mga we have or paano din yung yung exercise, paano mo nakuha yon kasi kasali yun sa CPGs, 'di ba, Kay? Can you expand 3 times a day, ganyan? Although we have some parang computation. Can you
Opo.
expound na lang for the benefit din ng iba?
Okay po, Doc. For the Pinggan Pinoy, Doc, usually it is composed of 33% carbohydrates, 33% vegetable, 17% protein, and 17% fruits. So if i-visualize siya, parang apat ang division sa plate with the different components. And then usually kung ano yung available sa Philippines na mga depende sa staple food ng patient, example, nasanay na sila in eating yung mga tawag nating bigas, mais na bigas, we do not usually implement na ipa-shift natin sila sa like mga rice talaga kasi maize rice is also considered a carbohydrate. So we do not available resources in the community. And then another is for the physical activity. How do we compute for moderate intensity? So we have to reach the target heart rate. So that is around 64 to 76% of the maximum heart rate. How is that? So of the patient, so that is our target heart rate. And then after which, so for the minimum, example, yung patient natin, no, is ang kanyang age is 52. So 220 minus the age of the patient 52, that's 168. And then for the 60%, so 168 times the percentage, or which is 0.60, example 64, so that is around 107. So that is the minimum heart rate to achieve the moderate intensity. While for the maximum heart rate that the patient should exceed it is parang 168 times 0.76. So that's around 127 ang kanyang maximum heart rate. So they have to maintain that, yung mga aerobic exercise for around 10 minutes, yung parang hinihingal na, parang catching their breath daw, parang nagsasalita. Parang that is also an indicator that you have achieved yung heart rate na dapat mong ma-target. And then, check the pulse during. So, dapat ma-feel mo na may parang increase yung parang, decrease yung frequency ng pulse. So, parang sabihin, umakyat yung heart rate mo. Yun po, Dok, naintindihan kaya? Hello? Okay.
First year, to probably sabihin niya, share yung take-home points niya from what was discussed. And kahit short lang, like you have learned about or refresh on this particular principle, and then probably we'll review or read more on what, and then ilagay sa portfolio.
Hello, Doc Weng.
Yes.
Yes. Ano po ulit yung Doc Weng? Medyo hindi po namin nakuha po.
Like, probably you can include in your portfolio as probably learn about or refresh on this particular principle, and then you can expound, and then pwede ring ilagay nyo ay klaro sa discussion. Kasi alam ko marami different, iba-iba yung mga nakuha nyo, iba-iba yung mga needs nyo with regards to particular principle.
Oo, at yun yung sabi ni Doc Weng. So for in this case, ano yung ano mo na learn sa family principles, parang ganun, and then like in this case kasi like Doc Weng, can I ask Doc if after nag-CA, this is behavioral din kasi Doc, should yung motivational ba or the lifestyle counseling should also be incorporated in the next Doc?
That's why I asked ano yung context ng pasyente, kasi this is where the patient is coming, no? And this is where we can actually conceptualize kung ano yung ng pasyente is CEA, hindi lahat motivational interview, hindi lahat yung identification of the context of the patient as to yung disease, anong nakukuha, ano yung thoughts niya. So doon tayo nakaka-plan. And I understand na siguro at one meeting sa pasyente, hindi naman kaagad natin yan nakukuha. Kaya I throw that question kanina so that sa succeeding meeting ni Kay, pwede niyang ma-identify yun and probably can update sa portfolio niya as to what particular or what appropriate counseling technique ang pwede niyang gawin for this patient.
Yes po, Doc. Ano talaga yun siya, Doc? Big learning point din yun for me po, Doc.
Okay, thank you po, doctors. If there are no more questions po, wala na po ba? I would like to thank our consultants for all the inputs po and suggestions for the improvement of the management of this particular family, and also to our thank you, Dr. Aki, for sharing with us your first enrolled family during your first year in residency. At this point, if I may ask Dr. Majo if there are announcements po, Doc Maj.
Announcement lang tomorrow. Lahat na ba nakapag-download ng DocQuity app? If yes, and if none pa, please download. Tapos register na lang. 10 a.m. tayo tomorrow for Fabi's presentation. Please support. Tapos after nun, yun lang naman ang activity tomorrow. The rest, seniors na ang activity. Thank you. Thank you, Doc Weng.
Thank you.
Thank you, doctors.
Thank you, Doc.
Dr. Aki.